Voice of Indonesia. VOA.
Voice of Indonesia from Indonesia to the world. Listener, the World Health Organization said that 1.6 million people died of TB in 2021. Although we know at that time there's a lot of COVID-19 cases, but TB is still there. But the good news is 74 million people were saved by global efforts to end the TB. In short, TB is still a threat, but yes, we can do something about it. And to talk about it, we have a pulmonologist at Persahabatan General Hospital, Dr. Faizah Hatim. Hello, Dr. Faizah. Okay, I have mentioned about the COVID-19 pandemic before, and as we know, people like you right now wearing the mask and also sunbathing and do a lot of stuff. Does it help us to reduce the TB cases right now?
Okay, and after the pandemic era, the people more aware, to use the mask and to maintain the healthy lifestyle, of course, to keep up the immunity.
Okay, so people are more aware and they save themselves better right now.
Yes.
But does it help to reduce the TB cases?
Yeah, maybe it's the perception. The
Wrong
TB
perception,
case, the TB cases is not decrease, when the pandemic come, but it became more decreased and under-reporting.
Okay, so less people reporting that they got TB.
Because people are more afraid, more afraid being diagnosed by COVID-19 rather than diagnosed with tuberculosis.
Okay.
Because they have a same symptom. Yes, they have the chronic cough, they have a fever, they have a shortness of breath. That symptom is similar in the COVID and also tuberculosis. So the TB cases is not decreased right now. However, TB cases in Indonesia is even increased. Right now, Indonesia tuberculosis is in the second rank in the global.
Globally, we have the second most TB cases.
Yes.
Oh no.
We in the first place there's India, and the third place is the China.
Okay, so India, Indonesia, China, in this neighborhood only actually.
Yes.
Right. And actually, you said that the COVID and TB has similar symptoms. So how do we know if we actually got TB?
Yes, TB in Indonesia, TB is an endemic disease. So we all, especially the healthcare workers of the or the people with the low immunity, such patient got the hemodialysis or patient with the immunocompromised, they're more in the low immunity response is more prone to have tuberculosis. But TB is not in the low income community, but also in the high income community.
Similar.
Is also
The rich and the poor, they have TB too.
Yes, in the patient such they have diabetes mellitus, they more prone to have tuberculosis. So when we diagnose diabetes mellitus patient, we have to seek if this patient have a active tuberculosis.
I see. Oh,
yes.
So when they have diabetes, it's not only about the diabetes itself.
Yes.
It has a friend.
So TB and diabetes and TB and HIV infection is have a connection. So when we diagnose diabetes patient or HIV patient, we should seek if there's a patient have active tuberculosis.
Okay. It's similar as the COVID-19. If you got COVID-19 plus another diseases, it will be more fatal for you. But for TB, besides diabetes, besides HIV, do they have more partners in crime?
Yeah, maybe if the patient have a combination, if patient have diabetes and patient have tuberculosis in the same person, the person maybe they have a longer duration treatment. Yes. Why? Because if the treatment of anti hypoglycemic oral and the anti-tuberculosis drug, they have the interaction. So they needed a more longer duration. If the patient have not diabetes mellitus, they will treat around 6 months. Yeah.
Okay.
But if the patient with uncontrolled diabetes mellitus, they will treat with tuberculosis until 9 months.
So those patients needs to be more patient in
More
having
longer, yeah, more
longer
longer.
treatment. Although this is not laughing matter, right? We're just trying to make it light so that people still wanted to know about it. And knowing more about the TB itself, what are the misconceptions that until today, sadly, we still have about the TB?
Yeah, maybe in the community, TB is community is still a stigma. Yeah, stigma for tuberculosis is still increase in the community. Yeah,
Still trending the stigma
yeah,
right now.
still trending.
For example,
Yes, TB patient can infectious other people.
like COVID.
Yeah,
Okay.
right. But TB patient, the stigma in TB patient can become the patient delay for diagnose and for to follow up treatment. Yeah, and the stigma for tuberculosis patient can make the disease more spread in the community. So that's why we should support TB patient until they have complete the treatment.
I see. So social pressure, social pressure is
Not the
actually
pressure
harmful.
if we collaborating from one to another. I think it's not a problem.
If we instead of giving them stigma, instead of gossiping them with our
Yeah.
misconception, we have to support them and they will go to find the treatment. And is it easy to find the treatment of TB right now?
Oh, very easy.
Very
easy. In the primary healthcare, the anti-tuberculosis drug, not the at the primary healthcare, but also in the hospital, in the private hospital, in the public hospital, we can get the anti-tuberculosis drug for free.
For free?
For free. For
the whole treatment
for the
until
whole
we
treatment
are...
until the doctor said that you complete the treatment.
Okay, so for example, I do not know whether I have TB or not. So when I go to the doctor and I want to get checked, what will be checked from me?
Okay, if you right now you don't have any symptom of tuberculosis, right?
You sure?
Yeah.
Hopefully I don't have
Yeah.
the TB.
If the patient had a symptom of tuberculosis, like chronic cough or bloody cough, hemoptysis, or
Hemoptysis, what is it?
bloody cough.
Bloody cough,
Bloody
it's the same
cough,
name?
yeah. Bloody cough or hemoptysis or increased body weight or
Increased
short-
body weight.
Yeah.
Okay,
Do you have any of the symptoms?
only for the increased body weight. And
Maybe
then
you
go to
yeah.
the gym probably. Okay, the
Yeah.
next ones.
and the fever,
Fever?
subfebris fever. It's different from the COVID-19 infection that
Okay.
they have a higher fever
Okay.
because they caused by the viral, not the TB caused by bacterial
Bacteria.
infection.
Okay.
So if the patient had a clinical symptom of tuberculosis, they can go to the primary healthcare or clinic or the hospital, and then they go to check the sputum. The sputum check for they had a gene expert method. Yeah, it's called a gene expert method, and in the result we can know that this patient had a mycobacterium tuberculosis or not, the causal, and if this patient still susceptible with the first line anti-tuberculosis drug.
I see. But do we need to check all the boxes to be said that we have TB? Like, for example, we have to have the chronic cough plus the bloody cough and then increase weight, or just one of it we should check to the doctor?
Yeah. The more typical symptom is the chronic cough. Yeah.
Okay.
But not only if the patient, as I said before, if the patient had a low immunocompromise, such as diabetes mellitus or HIV infection, or patient undergone with hemodialysis, the patient had more untypical symptom. So the patient maybe they don't have the chronic cough, but they have decreased body weight or
Okay.
loss of appetite, and the night sweat maybe.
That's right.
Yeah.
Okay. But how many days of coughing the cough will be called a chronic one?
Okay. The chronic cough, it's called chronic cough is the patient have around 2 weeks.
2 weeks of coughing.
Yeah, 2 weeks. Every day.
Every day, the
Yeah.
whole day, the
The whole day.
24-hour coughing.
24 hours.
Okay. So if we have this coughing for 2 weeks, I mean not 24 days, for 2 weeks, so it means we should go to the doctor, check it
Yes.
nicely. Okay.
Okay.
Okay. So we know when to check. The treatment is actually so accessible in Indonesia. We are so happy about it, and also
And it's also free.
yeah, free,
Free
accessible.
free for diagnosis and free for the treatment.
The diagnosis too.
Yes.
Okay.
If the patient had undergone the sputum examination, or for the chest X-ray, and for the anti-tuberculosis for 6-month period or 9-month period or longer, they had for free.
Another assurance for Indonesians to go and checking themselves,
No,
right? It's
yeah.
it's so easier and even free. So because it's the World TB Day and they have the theme, it reminds me of Obama actually. Yes, we
Yeah,
can
yeah.
end TB. Yeah. So what do we need to do together to end TB?
Yeah. As a government policy in the 2021, the president of Indonesia Republic had already declared that tuberculosis is the problem for not only the healthcare professional. So TB is have to be the problem for the other sectoral. Yeah.
Okay.
So the problem is caused by TB is not only the health problems, but also the social problem, economic problem, and so on.
Okay. So all of us has to pay more attention, not only for the doctors or even the nurses, but also the listener of Voice of Indonesia, whoever you are, you can also join hands in fighting
Yeah,
TB.
we have to collaborate for each other.
Okay. Okay, thank you very much, doctor, for joining
you.
us, and
Thank you.
hopefully everybody will stay healthy and
We can end TB in 2030.
2030.
2030 in
How
the
many years again?
in the next 7 years.
7 years. Okay, 7 years is long, but I think by doing it together,
Yeah.
we have billions of people on Earth. I think it will be easy for, in the quotation mark, easy if we want to do it, right?
Yes.
Of course. Okay, listener, that's our talk about the TB. Hopefully, you will get something from our talk right now. And do not forget to subscribe to our YouTube channel, VOI Official. Thank you for joining us and stay tuned in the Voice of Indonesia, from Indonesia to the world.
Voice of Indonesia. VOI.